Hi, I'm Julio, and welcome to the very first episode of Liberation Podcast, the space where we bring you the latest updates from the European Liberation Project. In each episode, we will speak with doctors and researchers involved in the clinical trial to learn firsthand how this initiative is helping to improve the treatment of liver cancer. For this first episode, we spoke with Dr. Dimitri Dorcaratto, a surgeon with extensive experience in liver ablation who is directly involved in the Liberation clinical trial. We talked with him about his professional background and how he became involved in this exciting project. So let's take a look at the interview. Okay, so Dimitri, let's start with your professional background, please. Can you tell us a bit about your professional journey and what led you to become involved in the Liberation clinical trial?
Well, I did my surgical training in the Hospital del Mar of Barcelona, and it's where I started to know the potential of the ablation of liver ablation, and I did my PhD study on the ablation of another important organ, which is the pancreas. And then I got a fellowship in transplant and liver surgery in Dublin, and now I'm currently working here in Valencia in the Hospital Clínico. And during all this year, I've been collaborating with several studies which have been developed for the investigation of the use of thermal ablation in liver and pancreatic surgery.
Okay, so you collaborate with Fernando Burdillo's group, right?
Oh, since I was a kid, almost.
Excellent.
Was the director of my PhD.
He was your thesis director. Okay.
It's a big friend of mine.
So, Dimitri, what do you believe that the Liberation Project is such an important step in liver cancer research?
Well, in liver cancer, both in the secondary lesions, which are the liver metastases from the colorectal cancer, and in the primary lesions, which are almost always hepatocarcinoma, we have a big problem, which is the local recurrence in the site of the resection of the tumor. Especially now that we are doing more and more minimally invasive surgery, and we are pushing the boundaries of the resection inside the liver, there is a problem with the local recurrence. And this study is aimed to try to solve this problem. If we achieve to solve this problem, we can benefit several thousand patients every year which are treated by liver surgery.
Mm-hmm. That's a great point. As you know, Liberation is a large multi-center clinical trial. What would you say is the most exciting aspect of being involved in a project of this scale?
Well, it's very important because I think the bigger is the trial, the more hospitals around the continent are involved, the more we can learn about the use of thermal ablation in liver surgery. Because every hospital, every group, every oncological group have some difference in their way to treat the patients. But once we put all them together, we can have results of the real life of hepatic surgery all across Europe in 2025. So it's very interesting from this point of view.
Yeah. So Dimitri, connecting with what you already said, no? What are the main challenges that you have faced when treating patients with liver metastasis or hepatocellular carcinoma?
There are several of them. Concerning the the treatment and the study we are doing, I think the challenge, the current challenges in the clinical practice nowadays, it's exactly the problem of the local treatment of patients which could have several lesions in the liver. We are treating patients with maybe 5 to 10 liver metastases sometimes, or very big hepatocellular carcinoma, which are very difficult to resect. And every time we treat this patient, we push the boundary on and on, and the margin of the resected patient parenchyma of the liver are smaller and smaller. And it's a very big concern about the local curation of the local recurrence of the treatment. So this is the main challenge we can fight with this with this study.
And how do you think that this project might address this challenge?
Well, I truly believe this the thermal ablation of the surgical margin, it's a way to secure what we are doing in this moment. Sometimes we have very thin surgical margins of 1 millimeter, 2 millimeters, and sometimes we don't even have any surgical margin. We do some resection which are very near to vascular structures, so we cannot go further, and we have margins of less than 1 millimeter. In these cases, thermal ablation, I think it's a very, very good tool to ablate all the surface of the parenchyma and kill all the possible tumoral cells which are allocated in the parenchyma near to the resection.
That's very insightful.
Yeah. I hope it works.
Everyone. Okay. And Dimitri, what will you say makes the liberation approach different from other treatment methods you have used in the past?
The truth is that before this study, I've never been in a multicentric study which was trying to do the ablation of the surgical margin in a protocolized way, in a way which is equal for everyone. I think every hepatic surgeon has his own way to do it because everyone is concerned about the surgical margin, and sometimes we just burn it with a normal cautery, or we try to use the CUSA or whatever. There are several methods, but this is the first time we are trying to do it in a protocolized manner and try to demonstrate scientifically that we have to worry about the surgical margin, and we have to try to, if we cannot achieve a big one, at least we have to try to ablate all the part. So this is the most important, I think.
And the protocol has already been submitted, no, to a clinical journal, no, very recently.
Yes,
right?
yes. It has already been submitted, and we are waiting for the response from the journal. But I'm pretty sure they're gonna accept it because this is a very, very well designed trial with a lot of people involved in it, and I'm sure that it's gonna be published, and then the results of the trial are gonna be published in several very important journals.
For sure. So,
yes.
Dimitri, let's talk about the patient, okay? Because
the what?
The patient. Okay. So how do you ensure this safety, okay, and comfort of the patient when they are participating in such a big trial like Liberation?
Well, we have to. First of all, we have to acknowledge that the ablation of the surgical margin of the liver, it's already in use in all the hospital around the Western countries with several different devices which use the ablation for the coagulation of the surgical margins. In the devices used in this trial, the Coolingbis and the Aquamantis are already in use and accepted for their use in liver surgery. So there is nothing new and nothing to worry about on that kind of for the patients to be involved in this trial. The safety has already been demonstrated several years ago. The only thing we are offering to the patient is the possibility to increase the long-term survival and to decrease the recurrence of the tumor inside the liver. So I think it's a very safe trial which we are offering to the patients.
Safety is always priority, of course.
Yes.
Yes. And Dimitri, now you are being involved in the training sessions of the trial. Can you tell us more about your role in those and how the training contributes to the success of the clinical trial across the participation sites?
Yeah. Well, in my case, I've been using the device of the trial for several years, so I already know how to use it, especially in the liver. But I'm sure that some hospitals which are involved in the trial are not so used with the use of the devices for the thermal ablation. So you have to be careful with the use, and you have to know what product you are using. In my case, the training was especially focused on the protocol of the ablation at the end of the surgery, which has been protocolized and well described in the study protocol. You have to do small circles for 50 seconds, and it's very important that all surgeons do it exactly the same way, so we can compare the results between Italy, Spain, Poland, and all the countries.
Mm-hmm. Mm-hmm. So it was like the first time that this method established a standard, no, in the clinical settings.
Exactly. It has already been used for several years now in the coagulation of the surgical field in the liver surgery, but this is the first time we are trying to use it to decrease the rate of local recurrence. So we are trying to establish the protocol of use of this product now.
Okay. So and this is also the difficulty to coordinate 24 centers across 7 different countries in Europe, recruiting more than 700 patients. So it's
a huge trial, and Patricia Sanchez, with is behind all this. It's a great coordinator, because I cannot imagine the number of emails she received every day of this trial, and I'm very happy I'm not the coordinator of this trial.
So it's a big challenge. It's a big challenge.
It's a big challenge, but there is also a big gain at the end of the challenge, which is the treatment of the patient.
Of course, and also a big benefit, okay, for the patients, because
exactly.
So I'm thinking on that. What are other difficulties? No, if you found any difficulties while working in such a big international trial like this, and how you manage these difficulties?
I've been coordinating some multicentric trial, not this one, And I think it's really, really challenging to get sure that everyone does exactly the same in every hospital, especially if it's an international trial, because every country has its own idiosyncrasy. So it's going to be quite difficult to coordinate all of this and to be sure that everyone does exactly the same. And once we have done it, they will help also to be sure that all the results we report from every center is correct. That's why we have an external monitorization which is going on. And this is another big challenge, the external monitorization in the trial. But it's necessary to be sure that the results are the real ones.
Okay. And Dimitri, now when it comes to the patients participating in the trial, what kind of feedback have you received from them regarding their experience so far?
The patients are blinded to the procedure we are offering. So, and most of them are operated by minimal invasive surgery. So I have to say we don't have any complaint about the treatment we did, and especially patients which have no complication and are operated by minimal invasive surgery. They are very happy normally of the results of the surgery, because before the surgery we tend to scare them a little bit with all the possible complications, and they have to sign a lot of papers and stuff. And when they see that they are treated and they go home in about 3 or 4 days, they are very happy.
Mm-hmm. So you make them happier.
Yeah. Exactly.
So how do you think the project like Liberation will help to shape the future of liver cancer treatment?
I think there are two main pillars of the treatment of liver disease. One is are the systemic treatment, chemotherapy, immunotherapy, and the other one is the local treatment, which is the one which is in the hands of hepatic surgeons. Liberation is going to try to solve one of the biggest problems of the local treatment, which is the local recurrence. So if we can achieve a lower rate of local recurrence, we are really improving the survival of patients with liver cancer.
The good thing is that you can apply everywhere, right?
Of course, in the liver, it's you can use the ablation on every surface of the liver without any problem.
Yeah.
Okay. I think before we resume, we'd love to hear your professional insights. When you first heard about the Liberation Project, Dimitri, and what made you decide to get involved?
From one point of view, I have been collaborating and working with Fernando and Patricia for the last 15 years now, and I've been involved in several trials with them. And I know that they are excellent investigators, excellent coordinators. They've never done something which is not useful for the patients. So I really trust them. I really trust them. And I think in Spain, there are not a lot of people who can run a trial like this. And they are the best one in this way. So when they propose me something, I tend always to say yes. And then after reading the protocol, I really saw that this could be a game changer in hepatic surgery, and I really would like to participate to it. So here I am.
So, and this after you have analyzed the protocol and you are applying right now, no, with real patient in the trial. So it's this trial expanding your understanding of liver cancer treatment in a way that you didn't expect, or not?
I already knew that Patricia and Fernando were working on the local recurrence of the tumor, liver tumor with ablation. And it was very interesting for me. So this trial is just the only scientific way we have to prove that it really works, and it's something that really matters.
Okay. And from your point of view, what makes the collaboration between so many countries and institutions in Liberation unique?
It makes very difficult for them to organize it. But from the other way, nowadays, if the European community wants to create real good trials, which can be at the level of the American and Chinese trial, the only way we have is to collaborate between several countries in Europe, because none of the European countries has got the power and the number of patients to create a trial like this. So this is the only way, in my point of view, in which we can design a real trial, and is the way the future is gonna be.
Okay. So do you remember or can share with us an experience that I don't know if that impacted you the most? Okay, for example, first patient treated or something similar.
Well, I started doing liver ablation in an experimental setting in the University of Barcelona like 15 years ago. So I was quite amazed of the power of the ablation techniques in the liver. But it still surprised me how easy it is to coagulate when you have a powerful ablation tool, and how clean and how dry is the liver surface after the end of the surgery.
Okay, and now, what role do you specifically play in the trial, and what's been the most fulfilling aspect of your involvement?
I'm just, I would say, in our hospital, we are 4 investigators, 4 surgeons, which are participating to this trial, and we all operate, and we all use the devices, and we are all involved in the trial. I'm just the link, the connection between the coordinators in Barcelona and our hospital. And but the reality is that I'm just doing the linking, and the rest is completely shared with my my partners in Ukraine.
Yeah, and referring to this, Dimitri, you know that the trials is a pragmatic clinical trial. Liberation is a pragmatic trial. So for us, it's also important the emotions, no, and the psychology of the patient, right? So how do you manage these psychological aspects for your patients?
Yeah, no, it's a pragmatic trial, especially because Fernando Burdio it's very enthusiastic in pragmatic trials since the beginning. Always want to do things that cannot be applied in the reality and they just don't stay in a lab, but they can be used in the real world. And we are using several tools to define the quality of life of the patient before and after surgery. And this is very important because at the end of the day, after survival, quality of life is the second most important objective and aim of any study. And so we are using these tools, and these tools are also focused on the psychology, on the psychological aspect of the patient before and after the surgery.
Mm-hmm. Mm-hmm. Okay. And well, there is not much left, Dimitri, but I want to ask you, what has been the most surprising or unexpected outcome for you to find this clinical trial?
Well, the reality is that I think what strikes me the most nowadays is that when we use the ablation in minimally invasive surgery, can be robotic or laparoscopic surgery, we really achieve a clean surgical fields after the use of the thermal ablation. And it's very easy to use, so it's a very good tool in that point of view. We already knew it, and now let's see if it's also good for the oncological results.
Mm-hmm. So we know that Fernando is also working on translating this methodology to robots, to the robotic surgery. So what's your feeling about that?
I think robotic surgery is the present and the immediate future of liver surgery, definitely, and so we will have to adapt on this new type of surgery, which is now the base of our clinical day-by-day practice. So it's just a way of adapting to this.
Mm-hmm. Yeah, and continue collaboration, because it's everything here, So
of course, as I told you, every time Fernando and Patricia say me they want to do anything, I'm available.
How do you maintain communication and collaboration with Fernando and the rest of other clinicians?
But Fernando now is the chief of the surgical department in Barcelona, so it's not so easy to communicate with him as it was before. But I'm a big friend of Patricia, and I try to send them emails because I don't want to bother them too much by the phone. But anytime I need to talk with them with urgency, I just pick up the phone and talk to them with no problems.
So
and then there is also Carles, which is the coordinator of the study on the scientific point of view, which is a big help. It's the one who help us, everyone with the doubts.
So you find that there is no communication barrier, no? So you get straight away to the people that you want to speak
Absolutely.
as soon
Absolutely.
as possible.
Yeah.
Okay, great.
And Dimitri, as you told, managing communication across so many countries must require a lot of coordination. If you could offer advice to other clinicians thinking about joining a large-scale clinical trial, like LIVERATION, for example, what would you say?
Well, if they want to join a clinical trial, I would say that they really have to read carefully the protocol and know the people who's coordinating the trial, as I did, because if you want to spend so many energies and time in a trial, you want it to be very well done. It's the case of LIVERATION, definitely. And if they don't want just to join a trial, but they want to design one, good luck. They really, really, really need help from many type of people. Not only a physician, but a lot of people must help you to design a trial like this.
Mm-hmm. Mm-hmm. Okay.
Okay, and Dimitri, yeah, my last question, okay, today for you. So, what are your hopes, okay, for the future of LIVERATION project and also for the patients involved in this clinical trial?
My hope is that we really managed to decrease the rate of local recurrence of the liver tumor, both the primaries and the secondary liver tumors. It's going to be some years before we see the long-term result of this trial. We already see that the method of thermal ablation is secure and it's feasible. It's not difficult in laparoscopy and robotic surgery. Now we have to see if it can really work to decrease the rates of local survival, of local recurrence, and increase the survival of the patient. I hope it works really.
We hope so. We hope so.
It's like all of us. Okay, that's all, Dimitri. Thank you so much for your time today. Your insights into the LIVERATION trial have been invaluable, and we are sure our listeners will find your perspective of liver cancer treatment very inspiring.
Thank you very much. Thank you very much for being here.